So thank you all for joining us this morning. I think we have some health advocates and faith leaders from across New York State. So we're really excited about that. My name is Kelly Moulton, and I am a convener of the Interfaith Public Health Network, or IPHN. And IPHN seeks to facilitate impactful relationships between faith communities and organizations to advance public health. We'll be speaking today about the intersection between programs meant to improve public health nutrition, be focusing on the New York State Department of Health's Creating Healthy Schools and Communities program, and some opportunities to fill gaps in creating healthy food environments through policy changes. And we do plan to host a series of webinars throughout the year, mostly focused on food policy and related issues. So this being the first one, so more to come. So please stay tuned. And so I would like to jump to the next slide. We have a welcome message from Rabbi Yonah Berman and our board member, Dr. Rachel Berman. And then we're going to have a welcome message from Senator Gustavo Rivera. Not hearing sound yet. We're not hearing sound on this end.
Hi, I'm Dr. Rachel Berman, and I'm a pediatrician and live in the Riverdale neighborhood of the Bronx.
And I'm Rabbi Yonah Berman, and I also live in Riverdale in the Bronx.
I also have the honor of being a board member of the Interfaith Public Health Network, or IPHN. IPHN is a network of faith actors, public health practitioners, science and policy experts, and community organizers who believe in the power of faith and the wisdom of public health science to transform the health of our communities.
Our Jewish tradition is full of injunctions to care for our emotional and physical well-being as individuals, and to care for the health of others, with a special focus on those in our local communities. Our faith teaches us to engage with science and to engage with other faith communities in the interest of a shared good for all of humankind.
We are especially honored to be presenting during this meeting with Senator Gustavo Rivera, who is our state senator. He is a champion for children's health and for public health in general, whether through supporting access to vaccines, helping people make more informed decisions about which foods they choose to eat, and promoting health equity in our community.
Thank you, Senator Rivera, for your friendship, for your leadership, and for your hard work during these trying times.
With that, I would like to introduce Senator Rivera, Chair of the New York State Senate Health Committee, who has been a longtime champion for the health and disease prevention across the state. Senator Rivera has represented the 33rd Senate District in the Bronx since 2010 and is sponsoring several pieces of legislation we'll be talking about today related to menu labeling. So Senator Rivera, thank you for being with us.
Good morning. That was actually a pleasant surprise. I did not realize that Dr. Berman and Rabbi Berman were constituents. So I'm glad to have got that surprise this morning. So good morning to them and good morning to everyone else here. Again, my name is Gustavo Rivera, state senator for the 33rd district, which includes the Northwest Bronx, which includes Riverdale, chair of the health committee in the Senate, and certainly a willing and happy partner to folks in the Center for Science and Public Interest and the Interfaith Public Health Network. So I wanted to just have a couple of minutes this morning. Certainly, I'm very glad that we're having these conversations. As far as so I've been elected senator. I've been here a long time. I've been here 15 years. It's kind of hard to believe sometimes. I've been the chair of the health committee since 2019. So it's been a few years since that has happened. But during my entire tenure, I've always cared deeply about public health and about and just making sure that systems are more available to people, particularly in the Bronx, since the Bronx, as most folks might know, over a period of over a decade, the Robert Wood Johnson Foundation has constantly found that they are the unhealthiest county in the entire state of New York. So there's certainly a lot of work that needs to be done to make sure that we can provide access to people, and in the case of the bills that I'm going to just talk about briefly, to make sure that people have the best information possible to make better choices about their health. I always find it a little strange that we don't have more conversations about nutrition when we're talking about health, considering that the fuel that we put into ourselves is the thing that actually, it makes us energized, makes us, less energized, you know, gives us, we can put a lot of stuff into ourselves that we might not know that we're putting into ourselves that then, particularly in added sugars and sodium, I'm meaning, that could ultimately have an impact on their major risk factors for all sorts of things that might impact people, whether we're talking about diabetes, high blood pressure, and other conditions. So the bills that I've there's a couple of bills that I've introduced. The numbers, let me see if I can find them in front of me. I should have the numbers in front of me, but I, I actually don't have the numbers on my list here, but we're going to talk about them obviously. These are bills that are both about making sure that people have the information necessary to make better choices about what they put into themselves. So we have whether it's on issues of sodium or sugar, I just want to make sure that people understand and recognize what it is that they're consuming. And with this information, both bills relate to making sure that we can have not small. It's not an imposition on small businesses, since it is something that is meant for how restaurants to have a lot more, a lot of different restaurants, not just one. Um, but it would require them to actually inform the public on sugar and sodium, and we want to make sure that's something that is statewide. Because again, I just believe that people should have the information necessary to make better choices about what they're putting into themselves. So this is just part of the overall strategy, and I'm certainly thankful for your conversations about this today, and certainly looking forward to the partnership that we will have uh, into the future to make sure that we can pass these bills and others to make people in the Bronx and the rest of the state a lot healthier than they are right now. Thank you so much for having me this morning.
Thank you so much, Senator Rivera. So, yeah, we appreciate your longtime championing of health in the Bronx and for helping to make sure that people have access to information they need to make better choices. So I want to talk a bit about some of the key factors that we need to think about in terms of making healthier choices. So I think I think Bob is going to be moving to the slide that I'm on right now. So in addition to my work with the Interfaith Public Health Network, for a long time, I worked on a program called Creating Healthy Schools and Communities, which is a program through the New York State Department of Health that I worked on through another hat I wear with Bronx Health Reach. And this program encourages schools and community organizations to adopt wellness and nutrition policies to guide the healthfulness of food available within these settings. And this program supports implementation of the Healthy, Hungry, Free Kids Act of 2010, which requires local school wellness policies that include nutrition guidelines, physical activity guidelines, and other wellness activities. And ideally, these policies should include nutrition education in schools so children can make informed decisions, but not schools even have nutrition education in their wellness policies, nor do all districts require it. So there actually is another piece of legislation, A604 in the Assembly, which is sponsored by Assemblymember Rosenthal, that would require schools to provide health education regarding food, agriculture, and nutrition. And another thing the Healthy, Hungry, Free Kids Act of 2010 did was to set nutrition standards for foods and beverages sold in schools. And starting in 2014, all foods sold outside of the National School Lunch Program, such as food from vending machines and school stores, known as competitive foods, have to meet USDA Smart Snacks nutrition criteria. And as I'll show you in a minute, competitive foods known as copycat snacks, as well as the food environment outside the school, makes it challenging for kids to make healthy choices, especially when some of the food from outside is brought into schools. So we're just trying to create a comprehensive, healthy environment, both in the school and outside the school. And the policies we're talking about today will talk a lot about how we can do this. And next slide. So, yeah, and There is a couple of links I think we can also share about smart snack standards, which are the standards that food sold inside schools need to follow, with standards around whole grains, making sure the first ingredient is a real food, such as fruit, vegetable, dairy, or protein, have a minimum amount of fruit and vegetable, and meet nutrition standards for calories, sodium, fats. And I think Sarah can share in the chat the Smart Snacks product calculator to see if your snacks meet the standards. And then in terms of the copycat snacks, since many traditional junk foods do not meet the Smart Snack standards, major food companies have begun reformulating their products of popular junk foods like Cheetos and Doritos to meet these standards so that they would not lose the in-school marketing opportunity. So these products called copycat snacks use the same brand names, logos, and spokes characters as are used to market traditional junk food. And copycat snacks are not widely available for purchase outside schools and are clearly designed to co-market traditional junk food to children in school. And children may have the copycat snack versions inside the school, but not knowing these are different than the versions outside the school may also purchase the original versions in their local convenience stores, and thereby getting both versions without knowing the difference, or that both versions still have other potentially unsafe ingredients. And next slide. We could move to, okay. Oh, there's the Smart Snack slide. Okay. We can go to the next slide. So one bill being considered right now in the New York State Legislature, known as the Food Safety and Chemical Disclosure Act, would prohibit the sales of food containing synthetic color additives in schools, which can cause or exacerbate neurobehavioral problems in some children. These and other additives are already banned in New York City public schools, and this bill would expand that ban for schools statewide, in addition to doing a few other things to protect New Yorkers from chemical additives in foods, which my colleague Bob will speak about shortly. Next slide. So in addition to the issue of chemical additives in foods, the food environment outside schools is laden with unhealthy options and marketing for those unhealthy options. So fast food is prevalent in the diets of children and adolescents, with 1/3 of children and adolescents consuming fast food on a given day. And sugary drinks are often part of these meals being consumed. And consumption of these products contributes to chronic disease such as type 2 diabetes, obesity, heart disease, and fatty liver disease. Marketing for sugary drinks targets children and teens, including Hispanic and Black youth. And fast food remains the most advertised food category to children and adolescents on TV, accounting for more than 1/4 of all food-related ads viewed. The total advertising by all fast food restaurants in 2019 was $5 billion, with more than half of this for individual high-calorie menu items and value menu and meal bundles. Next slide. And here's some information about how fast food ads target Black and Hispanic youth. So Black youth have viewed 75% more fast food ads than their white peers, and there's been a 33% increase in ad spending on Spanish language TV since 2012, with none of those ads being for healthy menu items. So this is the food environment that our kids are exposed to and the rest of society. And next slide. So in regards to options available in fast food restaurants, even when restaurant menus advertise healthier options for children, the reality inside the restaurants is different. While websites may only list healthier beverage choices for children, inside the restaurants, 1/3 or more list sugary drinks on their kids' meal menu boards, and at the counter, many automatically provide fountain drinks and did not offer any healthier drink options with some kids' meal orders. Even some kids' meal sodas contain more than a day's worth of added sugar. And most soda fountain drinks served by fast food restaurant chains contain more than a day's worth of added sugar. Even the small ones do. Medium can contain a day and a half's worth of sugar, and most large drinks contain 2 days' worth of added sugar. The leading sources of sodium in the American diet, accounting for 71% of overall sodium intake, are from restaurants and prepackaged foods and processed foods, compared to sodium that's inherent to a food or added during cooking or at the table. The average sodium content of a default combination meal at a chain restaurant in the US is 2,100 milligrams, and about 90% of people in the US consume excess sodium, with the average daily intake of almost 3,400 milligrams, nearly 1.5 times the recommended limit of 2,300 milligrams a day. And as Senator Rivera mentioned earlier, we do have bills in the New York State Legislature that would require warning labels in chain restaurants with products with more than a day's worth of added sugar and sodium, which my colleague Bob will talk about shortly. And I also wanted to mention there is a movement to establish nutrition standards for kids' meals in chain restaurants, with a bill in New York City that is expected to be voted on soon, and several other counties that have passed healthy kids' meal legislation, including 3 counties in Maryland. And Senator Rivera has a bill in the New York State Legislature that would establish healthy kids' meal standards in New York State restaurants as well, or at least was introduced in the last legislative session. I'm not sure about the current one. And CSPI is also interested in exploring the possibility of legislation requiring plant-based options for kids' meals in restaurants in select cities in the US, where there is enough interest and support. CSPI is Center for Science and the Public Interest, and they're one of the key partners that we're working on this legislation. And now I will pass it over to Bob to give us some more information about these policies.
So thank you, Kelly. I am Bob Pezzalezzi. I am the co-founder and co-convener of IPHN along with Kelly, and really excited to talk to you today about our policy platform. And I'm going to dive right in, looking at these community food environment pieces of legislation. Noting, as Kelly mentioned, that we are funded in this work by our great partners from the Center for Science and the Public Interest. And the first bill is the Predatory Marketing Prevention Act, which is sponsored by Senator Zelnor Amiri and Assemblymember Carinas Reyes. Kelly talked about, with some Red Center information, the really intense food marketing for junk food, fast food, and other unhealthy products that young people are exposed to. You may be familiar with some of the recent research, which has shown the impacts of this marketing, which is particularly insidious in the digital space through social media and various forms of targeting. So this bill actually passed the New York State Senate last year, but was stuck in committee at the Assembly level. So we're excited to get it moving this year. And I'll also note we are going to be having a press conference for this at the New York State Capitol next Tuesday, the 25th, exact time to be determined. So if you're interested in that, we're going to share our contact information. If you can make it to Albany, we'd love to have community groups, public health groups, faith leaders there for that event. Next, we'll get to these bills of Senator Rivera's that he talked about, that he has championed, which help make consumers make more informed decisions when they visit chain restaurants, defined as restaurants with 15 or more locations nationally. So the first is for excessive sodium, requiring warning labels on menu boards and signs in chain restaurants for items and combos that have more than a day's worth of sodium or 2,300 milligrams. This essentially extends the New York City policy, which was instituted in 2015 statewide. So that the upstate folks get the same privilege to be able to get this information when they go to chain restaurants. And if you're like me, you'll try when you eat out to try and find some healthier options. But as we can see here from a couple of these examples, even things that you might think would be a little healthier, like a Chipotle or Panera, can still have more than a day's worth of sodium, which is why these labels, warning labels, are so important. This is another bill that passed the Senate last year, but did not get through committee in the Assembly. And it's already passed the Senate Health Committee thanks to Senator Rivera's leadership, and we're really looking forward to getting this passed. A related bill, another one that the senator talked about, is the added sugar warning label bill. And we're particularly excited about this because we at IPHN help lead community engagement and mobilization with CSPI for this successful package of the New York City version of this bill, which passed in 2023 and is slated to be implemented this October. So look for that, folks, in the New York City area. And this would require warning labels on menu boards and signs in chain restaurants and at the point of beverage dispensing, which is important since largely we're talking about sugary beverages here for items and combos with more than a day's worth of sugar. So that's 50 grams or 12.5 teaspoons. And this is an area that's really intensified and gotten worse in many ways just because some of these products. Our colleague, Dr. Deanna Nara at CSPI has at various events shown by dropping sugar packets into some of these drinks how much sugar is in them. This Dunkin' Triple Mocha frozen coffee has 159 grams of sugar for a large. That's over 45 teaspoons of added sugars. And then also another very important bill with this issue being in the news a lot lately is the Food Safety and Chemical Disclosure Act from Senator Brian Kavanaugh and Assemblymember Dr. Anna Kellis. Dr. Kellis is a nutritional epidemiologist and has lectured at Cornell, so she's really an expert in this field. Kelly mentioned the second piece, removing artificial food dyes from New York City public school foods. Important, and again, another area where upstate school children should have the same safety as New York City school children who already have these things removed from their food system. Two other things this bill would do is it would remove these three health-harming chemicals from New York State foods, including red dye number 3, propylparaben, and potassium bromate. Red dye number 3 has been linked to cancer and behavioral problems in children. Propylparabens have been linked to hormone and reproductive system harm, and potassium bromate has been linked to cancer. They were banned in California last year, and they're not allowed in these other nations. Now, Red 3 was banned by the FDA, but my understanding is they're still including in this bill just to make sure that happens in New York State. And, you know, it's very important that states take leadership on this because the FDA was already not doing a great job with protecting folks from a lot of these chemicals. We've got a lot more information on that we can share that's on our website, on our food justice page. But that was bad even before the current cuts to the FDA under the Trump administration, where you may have seen the news that the leader of the FDA's food division resigned because the cuts were so severe. So really, states have to take the lead to be able to protect their citizens from these chemicals. And that connects to the third element, which is setting up a database that the New York State Department of Agriculture and Markets would have. We don't have enough time to get into all the details of it, but suffice it to say that there's a regulatory loophole that companies have been using where essentially they're putting chemicals in food and we don't know if they're safe. And there's potentially hundreds of chemicals out there where there really is not robust safety research on. So what this database would do is it would say if you're using this regulatory loophole, and this is companies calling their products GRAS or generally recognized as safe, a process that was originally meant for things like canola oil, vinegar, and black pepper. In other words, ingredients that we already knew were safe and they didn't want a big regulatory burden for them. Basically, these companies, if they're selling these products in New York State, would have to put this information in this database that would be available to the public and to public officials. It is currently, this bill is in committee in agriculture, and would also have to pass through the education committees, but I'll also add that the sponsors are actively working to include this bill in the budget, in both of what are called the One House budgets. And also, as Kelly mentioned, we're excited. There's a bill before the New York City Council that we think should pass soon, we hope. It's going through some last minute fixes that would require healthier kids meals for restaurants in New York City. It has 40 co-sponsors in the New York City Council out of 51 total members. So again, there's been a bill in the past, and we're really including this just as a potential bill, and we wanted to gauge people's interest to see if we'd be interested, this passing in New York City, could we pass it in New York State as well? If there's interest to make sure that these meals that are targeted toward kids in restaurants, that there would be some healthy options, including nutrition standards, and having things like fruit, no or low fat dairy, whole grains, and vegetables in these kids' meals. So, long story short, we need your help to get this legislation passed and to get healthier nutrition in New York State and protection from some of these harmful added chemicals. So I know there's a lot here. We're going to be following up with emails to everybody that registered today, but I just want to do an overview of what you can do. And again, lots of options. So hopefully there's something that can fit with what you would like to do to support this work. So first of all, obviously, we want you to encourage your senator and assembly member to co-sponsor or support those 4 bills, or thank them if they already had. It's especially helpful if they sit on relevant committees. We will share with you, if not now, then later, a link which gives you a kind of a quick list of all the members of these committees in the Assembly and the Senate. Check to see if they're your representative, and then reach out to them. Let them know you care about this and that this helps your community and the folks you serve. And we can help with that in any way you need. And we've got great partners that can help as well. At the individual level, there's an action alert, which we'll share for the New York Food Safety and Chemical Disclosure Act through CSPI and their leadership on this bill. There's also for individuals a change.org petition that I believe Senator Kavanaugh has started. So that there's there for direct contact with your legislators, but also a general petition for folks. We'll share an organizational sign-on support form. So you can sign on to all the bills at once if you want. There's also individual sign-ons if there are some bills that you support and others you'd prefer not to. Another exciting opportunity, we want to hear individual stories. So that can be your stories as professionals, community members, folks you work with. We want to hear from parents, teachers, faith leaders about these particular issues, and so that we can, communicate effectively about the need for these particular bills. So we have a Google form where you can add your story, let us know about it, and we can reach out to you with the communications teams we work with to get that story out there. For folks that are unsure, a little nervous about advocacy around these bills, we can help provide guidance on that advocacy, but we're always looking also to educate folks on this. We're happy to connect with you about educating the folks you serve. We want to do greater outreach in this work. And, we're just looking for your support. So if you've got other ideas of how you'd like to support these particular bills, please let us know and spread the word to your colleagues and communities. And we'd love to have you as part of our expanding coalition. We've had some Zoom meetings with a broad coalition. We're about to schedule our next one, which should happen in March, along with CSPI and some of our other great partners, some of whom are on this Zoom meeting. We'd love to have you involved with that. And, you know, we've done a lot of work in New York City, and that's where a lot of the base of our coalition has been. But, you know, we have a special need to reach out now that we're looking at the statewide legislation for folks from upstate and Long Island. And of course, you know, we're the Interfaith Public Health Network, and we're always looking to forefront faith partners in this particular work. And that is a good segue for me to pass it back over to Kelly to talk about our faith principles on food.
Yeah, thank you, Bob. And so, yeah, we know that eating habits are formed from a young age, and that we have really high rates of obesity and diabetes and all these diet-related diseases in the US right now. And that's why we think it's really important to start from a young age and make sure that children can be healthy. And we do have principles from various faith traditions that support making sure that we have healthy food. And just to get into this a bit more, caring for the health of our children is universally recognized as important by faith communities, especially as children represent the future. And as our Indigenous communities tell us, it's important to consider 7 generations into the future when deciding how we will live our lives today. And here are some principles for thinking about our food system that cut across faith communities. These were put into an interfaith statement that was read during the 2021 UN Food Systems Summit. It's put together by the Faith and Food Coalition. So some of these principles include interdependence, so recognizing that human health is linked to the health of the earth. So when we talk about eating more fruits and vegetables and plant-based foods, and this is both better for human health as well as the health of the environment. Truth. So science and faith are not at odds. They inform, enrich, complement, and challenge each other in their pursuit of truth. I know a lot of times people think we have to either choose science or faith, but that's not actually the case. And we have a lot of rich history from all of the various faith traditions that back up the connection between science and faith. Compassion, we need to ensure that marginalized communities are centered and uplifted as part of just recovery and sustainability initiatives. So, always putting the marginalized at the center and thinking about how do we make sure that the least among us are also, being cared for, and that we have healthy, affordable food for these communities. Right now, we have such a plethora of targeted marketing and unhealthy junk food that's really cheap in these communities, and we need to think about what are we doing to counter that. Solidarity. We should set aside our differences to work together as one human family for the common good. What do we need to do to collectively make sure that everybody has enough access to healthy, affordable food? And that the farmers are, treated properly, that they're getting what they need in order to provide us with that food as well. Empowerment, resilience lies within ourselves, our communities, ecosystems, and our faith traditions. So we can always tap deeper into ourselves to figure out what it is that we need to do to create more healthy and sustainable food systems and environments. And in this interfaith statement, we also called for regulating the marketing of food and beverages to children, preventing non-nutritious, chemically dominated foods from being sold as healthy substitutes to real food. So a lot of what we talked about today, and just to say that is backed up by faith communities from around the world. And that this is something that we need to work on in New York, and hopefully help to set an example for other states across the country to work on these policies as well. So With that, I'm going to